So we're going to talk about using the foam roller for your middle back, your thoracic spine. And you can orient it two different ways when you're using it lying on your back. You can orient it long ways so that your spine runs along it, and you can orient it across so that you can move up and down your spine with it. So I'll show you the long way first. To get on it, just want to lay so that it goes right along your spine. And your legs spread a little bit to help keep your balance. And then in this position, what you can get is a motion of your shoulders going back this way. And I will sometimes just let my legs relax too, so that this is also getting a little bit of a stretch in my hips. And you can change the angle of your shoulders through this whole range, but right around horizontal is where you're going to get the most effect. And you can roll a little to either side, like with it. I can reach with this arm, stretch. I can reach with this arm and stretch. I can push my backs of my hands or my elbows back into the floor to contract the muscles at different angles that take your shoulder blades back and down. And I can just lie here and breathe and just let gravity do the work too. You can cross your legs this way if that feels nice for your hips. I like that position. And just let that help you open up your shoulders, stretch out these anterior chest wall muscles and the muscles in the front of your neck. Okay? The horizontal way, you orient it this way, and to get on it, you can use your hands to kind of stabilize, then put your elbows on it, and then put your feet on the floor, lift your hips a little, find where you're going to start, usually lower ribs, let your weight rest there, then with your arms, just put your hands behind your neck like so, lift your hips up. So now your hips are up, and your shoulders are a little bit more below. The orientation of those vertebrae are, the way their architecture is they're slanted like shingles. So having your hips up actually helps you get better stretch. And so you can take it in both directions. You can go back toward the floor to extend your spine, backward bending, and you can do a sit-up. So picture the vertebra that the foam roller is touching, and then the one right above it, and you're going to move the one above it forward and then back. And then you can walk your feet to the next one, forward and back. And sometimes I just have to wait for the stiff ones to soften. And you can work your way all the way up to right at the junction of your shoulders with your neck. And you can let your head rest back on it. Reach with your arms, lift your hips. And to come off of it, just push down, roll back, and you can just sit, come up off of it.